I'm Dr. Carrie Gordon, and I'm an OBGYN physician working for Ogden Clinic at the Layton Parkway office. The person that stops and reminds me the most is probably my husband. He's a very supportive man, and there are often times when I forget to go to the doctor. As weird as that sounds, I hate pap smears just as much as anybody else. And so he sort of reminds me like, hey, how long has it been since this has happened?
Hi, my name is Megan Grunander. I'm a general surgeon with Ogden Clinic General Surgery. My office is a professional center north building, and I operate on patients at Ogden Regional Medical Center and McCady Hospital. People in my life that take the time to continue to remind me to just stop and take a moment away from the busyness of work and life and family, and to just take a moment and focus on myself are my mom, my husband, and my kids.
I'm Jan Davis. I'm a nurse practitioner that works at Utah Hematology and Oncology. My husband, he's always reminded me to take care of myself. He has a ritual every night. He comes by as we're doing something and sets out my pills in a pill box and said, here, don't forget to take your pills.
I'm Dr. Carl Gray. I work here at Utah Hematology and Oncology. The source of reminding and strength in my life is my wife. She's always there, and she's constantly helping me tell me what's important and remind me about spending time with both her and the kids.
Well, I think the most important thing when it comes to breast cancer screening is just that, screening. That it's important to have early detection of cancer or precancerous lesions, and the only way we're going to be able to identify those things is actually to do the recommended screening tools that we already have and other imaging modality that can help to really screen for and also diagnose early breast cancer.
Please do your exams, because we really don't want to have to give chemotherapy to patients. And if you get your mammograms and exams done, then usually you can catch the cancer very early when it's small. And that's really how I'd like all the patients to be diagnosed. It sounds like we want to put ourselves out of business, but that's okay.
We have a very well integrated team that works in collaborating care and taking care of the breast cancer patients. If a patient is diagnosed with a breast cancer, then my role is to serve as the surgeon and helping perform any surgical procedures that would be needed in the treatment of breast cancer.
In our name, it's Utah Hematology and Oncology, which implies blood diseases. Oncology means cancer.
We take care of all of the cancer needs for patients from start to finish.
What I have seen in the years that I've practiced is that most women don't take time to take care of themselves. I think that's the unfortunate thing, is that we're always so busy taking care of everyone else that we forget how important it is to really focus on our own health and make ourselves healthy. Because if we're not healthy, then we really can't help others.
I'm Jan Davis, nurse practitioner at Utah Hematology, and I'm here to remind you, please remind your loved ones to get their screening mammograms, do breast exams as indicated, and don't be afraid to seek treatment and care.
I am Megan Grunander, and I'm here reminding you so that you can keep reminding them.
I'm Dr. Gray, and I'm here to remind you so you can keep reminding them.
I'm Dr. Carrie Gordon, and I'm reminding you to do your annual Well Women exams and mammogram screening so that you can continue to remind your loved ones.